So I designed three instruments in combination with B&L stores and buy, and with the goal of making cataract surgery easier. So I'll talk about the first instrument. It's called the Wiley chopper, and it's a stabilizing chopper. And what's nice about it, it has one end that fits through the paracentesis with sort of a pigtail shape that allows you to stabilize the eye when doing other maneuvers. For example, stabilizing the eye for the corneal incision or stabilizing the eye for the rhexis. So the chopper can be spun around, and it's got a vertical chop so that when you're actually doing the cataract surgery, it's got a nice paddle-shaped tip that allows it for a great vertical chop for either standard cataract surgery or femtocataract surgery. So that's the Wiley chopper. The second instrument is a capsular rhexis forceps. And what's nice about the forceps, it has a guide as far as to guide you to make a nice, well-centered and sized rhexis, particularly in combination with the stabilizing chopper. You can stabilize the eye, get the eye in a good position, line up your Purkinje images so that you can make your rhexis on the center of the visual axis, and then you can size it with the gauge that's on top of the rhexis, so you can see the size of the rhexis and make sure it's centered and sized correctly. So in this age of femtosecond cataract surgery, where we're starting to get used to seeing these perfectly centered and sized rhexis, it's nice to have a manual technique that can compete with that. The third instrument is an instrument that's designed for hydrodissection for femtosecond cataract surgery and standard cataract surgery, but it particularly helps for femtosecond cataract surgery. What we've seen is that the cortex is a little bit more challenging to remove during INA. The cortex, particularly with femtosecond cataract surgery, can kind of fuse to the capsule, and it can be hard to remove with INA. With this hydrodissection, it's particularly designed to cause a fluid wave that basically often eliminates INA altogether, that at the end of the case the cortex can be completely removed from the capsule, so you don't have to do it the INA step. So basically it can either make it easier or eliminate INA for standard or femtosecond cataract surgery.